Hello, everyone, and welcome to another episode of the Low Carb Lifestyle Podcast. Today, we are here with Lynda Rose, who is a health and nutrition coach all the way over from Perth. Thank you so much for joining us today.
Thanks for having me, Tracy. I've been listening to your podcast over the last few months, so you've always got something exciting and new to tell everyone. So I'm interested to speak today and see what we come up with.
Well, you're the one who's going to share the exciting and new stuff because you're my guest. So we're all really looking forward to hearing more about you and the work that you do in the low carb space. But do you want to start with telling everyone what it is that you do and what brought you into this space?
Okay, so I am a lifestyle coach focusing on low carb because for me, my journey began with an illness, and low carb has definitely given me a better outlook on life and a better health perspective. So my passion is just to share all that's in my mind with anyone that cares to listen, really. It does look like I'm focusing more on remission for type 2 diabetes, which is where I seem to be headed, which is so important when you consider the terrible pandemic of type 2 diabetes in the world. And I don't think everybody really realizes that they might be heading towards that marker for having type 2 diabetes. And that's where my interest lies, because the normal Joe Blow in the street that might have a bit of a waist circumference that's bigger than normal and might have a bit of blood pressure doesn't realize that can all be addressed with a low carb lifestyle that will stop any more chronic diseases developing down the track.
Yeah.
That's where I lie. That's my focus.
Well, it's such a great focus to have and so important. I was talking to a colleague this morning, and she's a diabetes educator and a dietitian. And we were saying that exact thing, that, it's just so many people do not realize that, type 2 diabetes is something that can be picked up, maybe 20 years earlier, 10 to 20 years earlier with the right tests. And so many people walking around without realizing that they are insulin resistant and on their way there, which is such a shame, as you say, because it totally is, preventable, reversible with dietary changes. But, people just don't know, right?
No, they don't know. They don't know that they're able to make the choice. And I think I know as well, they just don't have the education to start off with just simple steps to make small changes every day that they can then grow over time, so they can begin to eat a better, healthier diet than what they were eating, 6 months prior when they started, because it is a journey. And I know for myself, it's sometimes really difficult to break the habits and move on, because it's a real mind game, and we all have to learn how to overcome our own little nuances and our little triggers that trigger us to move on. And that's part of the journey, isn't it? I found.
Oh, absolutely. I totally agree with you. I'd love you to share what you've seen around that for you. I mean, you mentioned that a health issue brought you into the space. Would you like to share with everybody what that was? And, then we can hear all you've learnt along the journey.
Sure. So it was back in 2011. I noticed when I was laying on my bed, actually talking to a girlfriend, that I had a lump in my belly. And I thought, that's a bit of a weird lump. Like, it had a real square edge to it. Like, it was definitely sticking out just below my rib cage, a little lump. And I showed it to my husband, and he said, I think it's nothing. I think it's been there for ages, And I thought, okay. So I finally went to my GP the next day I went to the GP. And I said, I've got this lump and I'm not sure what it is. So he had a feel, and he started talking lymphoma. And I thought, that's weird, because my mum had passed away from lymphoma only 4 years before that. So I thought, okay, well, I knew what lymphoma was, and for Mum it wasn't a really good outcome. She went through many years of chemotherapy, and she had stem cell implants and all of the things that you have when you've got a deadly chronic disease, and it sadly didn't help my mum. So I was rushed off, and it's like a slow motion movie when you've been diagnosed with a non-Hodgkin's lymphoma. So it's a slow motion movie, and you're sent off to see specialists, to have blood tests, to have scans, to have all these things. And it's just a really incredibly, amazingly scary time all at once. There's lots and lots of emotions that come that you can't seem to handle or do anything with. They're just there. You're just floating along with them. And I remember I had to go and have a scan of my spleen at the radiologist, Perth Radiological Centre. And I went on my own because I didn't think it was any big deal. I thought, I can do that. I've had 4 babies. This is okay. I can do this. And I remember the technician doing the ultrasound, young guy, rubbing the ultrasound gel on my belly and rubbing over the actual ultrasound tool or apparatus to scan me. And he said, that's a big spleen you've got there, isn't it? And I said, well, I don't know, is it? And he called in the head guy, and I thought, this is a bit serious. And they said, yeah, that's a pretty big spleen. And I said, okay. And then they said, well, Papa, you need to have a chest x-ray. We'll have to give you a full body scan, and now you have to have some blood tests. And I thought, off they shuffle you into the little cubicle with your gown on and your handbag. And I remember reading it was a Woman's Day or a Woman's Weekly magazine with one of my old favourite Australian actresses, Rebecca Gibney, was on the cover. And I just remember looking at her thinking, I think I'm going to be all right with this. Weirdly, what your mind does. I think I'm going to be fine. So I had to have a chest x-ray, and that was all clear and it was all fine. So at the end of the day, it turned out that I had inside of my body a 2.5 kilo spleen, and your spleen should be 80 grams or something smaller than 2.5 kilos. Wow. And I know it was massive. It was so huge. And within days, I had an appointment at a haematologist who was just a gorgeous, lovely, gentle old Scottish fellow, Dr. Patrick. And he was a gentleman and treated me with so much respect. So it didn't take long before we made the choice to remove the spleen. I think within about 2 weeks, we decided to remove the spleen. So he organised that to come out. So that was a journey in itself, because when you have non-Hodgkin's lymphoma, especially in your spleen, and I guess with any tumour really, you're always hot. So you're hot, and any room you're in is too warm, and you're hot around people because you've got this extra presence in your body. And I remember always feeling really warm, thinking that I was going through menopause, but I wasn't actually going through menopause. So we finally got to hospital. I had the spleen out. It was an 8-week recovery. And I remember Dr. Patrick saying to Dr. Archer, who was the surgeon, when you get this spleen out, Dr. Archer, will you please put it in an esky and send it by taxi to the lab, because we want to have it dissected and looked at to make sure what we're dealing with. And it's just so, I don't know, just so nonchalant, put it in an esky, put it in a taxi, send it to the lab. It's just, and you think, oh my God, that's my spleen and I'm not very well. And you're all so casual. They're all very, like they deal with this all the time. So I had 8 weeks on my couch waiting for the diagnosis, because that's how long it took to get that diagnosis.
Wow, 8 weeks.
Yeah. But what I wanted to say is, prior to any surgery for any cancer or any staging of any cancer, you have to have a PET scan. And a PET scan is the scariest thing in the world, because it's a radioactive medicine that they put in your arm. And you go into a booth that's just got a nurse that doesn't touch you and a machine that injects you. So the machine does the injecting. It's all very mechanical. The nurse isn't allowed to touch the equipment because it's all radiation. And the needle goes in, and this PET scan lights up in your body anywhere that you have cancer. So the reason that a PET scan does this, and this is why I started my low-carb journey, because it's quite pivotal to me, the radioactive medicine that's in that PET scan is loaded with glucose. So glucose is the carrier for the radiation, the material that goes into your body. And glucose is the carrier because cancer cells love glucose and they absorb it so quickly. So then you have a Christmas tree in your body. Wherever there's cancer, it will light up because the cancer cells have absorbed the glucose, which has absorbed the radiation, and that's how they scan you. So I guess I'm very fortunate because I recovered and I didn't have to have a chemotherapy. I had an immunotherapy, which worked for me, which was fine. So I didn't have all the hair loss or any of those horrible things that happen. But what it did do is put me on a journey to making sure I didn't consume glucose because I didn't want any cancer cells growing inside of me again. And that began the journey. That's
it. That's amazing. Couple of things. Firstly, isn't it incredible that there's organs in our body we can do without? Like the fact that they can go, oh, okay, we'll just take out your spleen. I mean, what's the purpose of the spleen? Did they explain to you? Like,
do you know, it's I have read a lot, and I keep forgetting to ask my hematologist exactly that question. But the spleen is one of your first immune systems that forms when you're in utero. So it has a big job when you're in utero, and it forms as part of your immune system. And then as you grow as an adult, apparently your spleen has a backup of immune cells that it uses when you have an infection. It also holds generally, if you have a bleed out, your spleen has a storage of blood, so it can send blood to the bleed out and make you not die, I guess. But I can't really understand what it's supposed to be doing for me at the minute because lots of people are walking around without their spleens. And incidentally, if you do have your spleen removed and your surgeon drops spleen cells in the wound, you can grow spleens through your body, which is another problem. Yeah, that's another problem.
So does that mean you need to be checked like regularly to see if that's occurring, or would you know?
I feel like it would show up on a blood test. I feel like there'd be some magical number that they would show up. But apparently your spleen can rejuvenate. So if they don't get all of your spleen out and they leave, a little bit behind in the right place, it can grow again. So I don't know. Maybe I've got a new one. I don't know.
Maybe.
That's incredible. For so long. Yeah, so the important thing to know is that I guess to stop all chronic disease developing in the first place is to stop eating sugar, stop consuming sugar, keeping your carbs low, and addressing that area of your life. It's not something, I mean, some people can change it overnight, can't they, Tracy, their sugar addiction, but some people it takes longer.
Yeah, I would say there'd be way more people that it takes a lot longer. It's a journey. You touched on that in the start about it being, a process. And I really want to come back to that now. So let's talk about how obviously you're in there having this PET scan. I mean, I've never had one, very, very grateful not to have one, but I never knew that that's what it did, right? So it was the glucose. I knew most cancer cells feed on glucose, but how incredible that they know that too. And that's what their dye is, so they can see where a cancer is. Now, so you're lying there, you see this happen. Thankfully, it was contained in the spleen. So what was the process from there? I mean, was that enough for you to go, oh, you know what? I got to stop eating glucose. I mean, because so many people don't understand. They get the sugar part, but they don't understand the carbohydrates part. So can you talk about how that looked for you? Was it somebody speaking to you? Did you just do your own research?
So that was 2011, and it took me, so I did have to have immunotherapy for 5 years. So it took me till 2014 to finish that treatment. That's 5 years, isn't it? So I guess within that time, I was at a gym doing amazing weightlifting and throwing sandbags around and carrying wheelbarrows and pushing things along the ground, heavy stuff.
That's horrendous.
With this guy that was an ex-army fellow, and he happened to introduce me to the learning of Paul Chek. I don't know if you've ever heard of Paul Chek. So I did go to his HLC1, which is Holistic Lifestyle Coach Level 1. Fortunately, it was held in Perth. And that set me on the path. And I think that wasn't long after. I'm thinking it was within that time period, probably 2012 or 13. And it just put me on the path to understand more about food than I had ever known, because my family wasn't really food conscious. You know, we used to have takeaways. My mum used to work at a deli and bring us home a big bag of lollies every Friday night for our treat for having put up with her at work. We were very sugary, cake oriented. So I suppose having the PET scan, and I'm a researcher, so something's happening to me. I want to know why. So I delved right into the PET scan and what that meant. And it just went off like a light bulb that I needed not to be eating sugar. Like, if I wanted to be well and healthy and stop this cancer from redeveloping, I have to be conscious of what I eat. And it just was a light bulb with the Paul Chek study as well, and many podcasts at that time that I was listening to. I just absorbed everything that I could about low carb, which then led me on to do my degree, my Bachelor of Nutrition, which I've completed last year. So that I can share that news with other people, because it's just everyone needs a light bulb moment, and I don't know how to make them have it, or they've got to have it for themselves. But mine was definitely the PET scan and my health, my future health.
So back then there was probably nowhere near as much information out there, as there is now. I mean, it's just I've been in the space less than you, 8 years or something, and it's just astronomically grown. And, that has pros and cons, right? Sometimes too much information can overwhelm people, so they don't even look at it. But I think the fact that, you managed to find what you did back then was fantastic. I'm curious to know with your, so you went and did your Bachelor of Nutrition.
Yeah.
Was there any low carb within that, or was it No,
there was no low carb within that. I did make sure all of my assignments and all of my essays and all of my work that I did was low carb oriented, because I kind of felt, I'm in this space, I'm a student, maybe I can prompt some ideas with the lecturers and just give them a bit of low carb information. You don't know where the penny will drop, who it will touch, who it will affect.
Yeah.
Yeah. So then the next step, so I did that for a while. I was slowly gaining weight during this time, thinking that I was eating healthy, thinking that I wasn't absorbing carbs. I don't know why I didn't know that, but I didn't. I was absorbing carbs, and I slowly gained 13 kilos. 13 kilos, and I didn't even know that I had gained 13 kilos. Like, it was just one day I had gained 13 kilos. I didn't feel fatter. My clothes didn't really feel super tight. But I'm tall. I'm 5'10", so maybe it spread around. Maybe it was all in my feet.
Maybe.
So I did start going and having some blood tests done, because I was going to a chiropractor. That was right. And she said, you need to go and get this blood test, this one, this done. And it showed that I had elevated blood sugar. And it slapped me in the face like a wet fish. I thought, what? How can that be happening to me? I'm doing all this study. I know the rules. I know what I'm doing. I didn't. And it just highlights me to the fact that anyone can think they're doing the right thing. And it's just a learning process to find out for their body that they're not, or they need to tweak things or change things. And so I actually hooked up with Dr. Pete, who I know you've had on this show. And this simple thing, the only thing I needed to change was I'd been trying to do keto and low carb, and I felt like I was doing low carb, but I wasn't doing low carb enough for me. But my problem was I wasn't eating enough fat. So all I had to change was putting a little bit of cream in my coffee instead of milk, and I put cream in my tea, which I felt was going to be terrible, but it worked for me. And the 13 kilos came off.
Really? Seriously? Yeah. Just that little tweak?
Just that little tiny tweak. So it can just be something small like that. And then, of course, I've upped my protein a little bit since speaking with you, and that's made a difference as well. So it's a journey, isn't it? Finding out what suits you.
Yes. Yes, and I think that's, when we've been through that, I mean, this is what makes you such a brilliant coach, because of the experiences that you had and the fact that you've had to, it's not like it was handed to you on a platter. I mean,
No.
you had to learn and tweak, and you said in the start, that there's triggers and there's different things that come up. And I think that's obviously the value of having a coach, with you to navigate that, because it happens to everybody. I'm such a big believer on people come to the low carb space primarily, most people, to either reverse their health condition or to lose weight. But it's actually the opportunity to step into a huge amount of healing and, really confront things that, we may not have ever had the opportunity to do so before. And I think in a way we don't get away from that. It comes up in our face because, we're asked to make so many changes and to believe something that's against what we've been told, and then to go and changes different to what maybe our family does or our partner does, or, talk a little bit about, what it looks like for you. What are some of the things you had to overcome, and what did you see from that?
So I guess as well, back in the day, I was cycling. Just to put it into perspective, I was cycling 250 kilometers a week, and I was gaining weight. So you often hear the saying, you can't outrun a bad diet. You can't outrun a bad diet. And so what it looked like for me was learning to intermittent fast, which I didn't find too difficult. I have a struggle in my household because my husband's not a low carber. So we have trouble with breakfast. And, it's hard to watch someone that you love eat porridge and bread. So that's difficult. But I find the hardest time is when you go out for a meal. It's just finding somewhere that's has something that you can have, and you've got to be the person that orders something without a dressing, or brings your own little pad in your bag.
That one.
Do you do that as well? Take it with you?
Well, not so much now. I did in the beginning. I definitely did in the beginning. And I think it was because it was just not so much, it was a little different, back there. And even asking for no toast was kind of like, what? But now it's just, they don't even blink an eyelid.
No, they don't.
And I kind of, I think you get better at kind of just navigating around it, and you start to see too that I don't really care what they think. This is, I've got to do what works for me. And if you don't accommodate me, well, I'll go somewhere else, basically.
Yeah. And I think as well as you go over the hiccups and you learn about that hiccup and that hiccup, it makes you more resilient to make the choices for yourself. Because, when you go through their hiccups, they're hard. Like learning not to have a handful of cashews every night, like a big handful of cashews, making yourself not do that, making yourself not have that ice cream after dinner, and you go along the pathway of maybe finding a substitute. I'll buy a low keto ice cream because it gets you over that habit, and just breaking that habit and allowing yourself to come out the other side of it with a habit change and not with a regret or a what if or should I still feeling. It's coming out with a strength, like a powerfulness. Oh, I can now do that. I don't have to have this or this. Or when we go out to a cafe, I'm all right if I don't have the cake. I'm fine with that. I had an interesting conversation with someone one day who said, I don't feel like I should give up my cakes. I shouldn't have to give up my bread, and I don't want to deprive myself of these things. And I said, well, I don't feel deprived of them anymore. Like, it's okay for me not to have those things because I don't see them as a treat. And I started looking at everything, and it might sound a bit dramatic, but I was trying to use the word poison for things that I knew I shouldn't be having, and that's how it clicked in my mind. Oh, that's just a poison. It's not going to help me. So I just used that as a bit of a mind shift to be able to shift my mind into something else, a better way of thinking or a different thing to eat or something. That's how I tend to look at it.
I think that's great, but it is those little things can make such a difference because, we know with habits from the brain, it tends to tell us that our life is in danger, and that if we don't have that chocolate or that ice cream, yes, all these stories about us, we won't survive, we won't be fine. Of course, we know in the work that we do, that is all made up. But just little shifts like that, that's poison. That's not good, because it is over a long period of time, right? And
that's what works for me. Yeah, that's what works for me. You have to find what works for you, and we're all so different.
Mm-hmm.
When you do have that light bulb and it does work for you, it's amazing. And the health benefits from a low-carb lifestyle are just beyond questioning, aren't they? They're just beyond.
Yeah. Totally. But it's also interesting how you said that, you were having a conversation with someone and they said, I don't want to give up this, I don't want to give up that. They're very, there's a lot of stories around that need to have that food, which is so understandable. And I hear that a lot too. And, my answer back is, well, first of all, no one's going to tell you that you have to give up anything, like it's, you need to decide what's working for you and what's not. Now, if what you're currently doing is working for you, then great, and you kind of, just sort of saying that, and they kind of go, oh, like it's almost like it's like the brain's going to go, oh, you're making me give it up. I don't want to do it. I don't want to give up.
Yeah. It's exactly like that, isn't it? It is exactly like that.
Yes, it's like we have a little tantrum.
Yeah, we do, and we think, oh, and we feel deprived. But it's just the way we have to move forwards. Yeah, I just had another thought in my mind, but it's gone. But it'll come back.
Oh, it'll come back. Well, interrupt me if it comes back. But just on that, I think that's such a powerful way to take the power away from it. Like to expect that to happen. We can't make changes to lifelong changes for some people, as it was for me, and expect it to be easy overnight. I think, we have this false belief that that's what it's like. And if it doesn't happen straight away, oh, well, then it's wrong. And I'm just going to, but
yeah, I just think as well, sorry, I just remembered what it was. In the world that we live in currently, I feel like, pre the war, just after the war, we all began to get used to the medical industry fixing us. Like they took away the right to labour naturally. Women had to go into hospital and be put up in stirrups and have their babies, and the doctors took control. So it changed all the birthing story that we have today. And we all just expect that the medical industry will just fix us. That's the way that we're brought up. We've got antibiotics, we've got pain relief, we've got medicines for heart disease, we've got things that we just expect the medical people will fix us with. And, they've saved my life. I'm not going to take anything away from them, because I wouldn't be here if I hadn't have had that wonderful medicine to heal me, and it healed me.
Yeah.
And along with my food choices. But I suppose we all at some point have to just, and I guess mature into the idea that our life is in our hands and we are the drivers of our future, and whatever we put in our body is going to manifest of some description. Even the medicine is just a coating or a veil of cover that offers you some promise, but at the end of the day, you still have to make those grown-up choices for yourself and steer your own ship, because no one is going to do that for you. No one is going to do that. You are the sole person that's responsible for your thoughts, your eating patterns, your activity levels, your relationships. Your whole life is you. No one is ever going to take control of that. You have to do it yourself. And it's just important to know that, because otherwise you do end up on the treadmill of the medical system, and it's difficult to get off it after a long time of trusting, changing your perspective to trust yourself.
Yeah. I love that. I love that. Couple of things in that. I think it's so hard to confront that and to acknowledge that, but the freedom and the power balance that it gives back into your favor is so worth every hard day and every day that you just want to throw your head over back into bed and just forget it all, because we all have those days. But it's so worth doing that, isn't it?
The glory moment. Let's call it that.
The glory moment. I love it. And the other thing too is people don't realize that medicine cannot fix lifestyle diseases. It is simply a Band-Aid. It is just about managing symptoms. It is not going to fix it. And I do think people don't know that.
Well, we've been brought up to believe that it's going to fix us, and I guess I'm going back to my lymphoma story. I just had great hope that the doctors would fix me, and I didn't know why I had developed non-splenic, what was it? Marginal zone, non-Hodgkin's marginal zone splenic lymphoma is the actual label, I think, is the complete thing that I was given. I don't even know why that happened. Why did I get that in the first place? But you can't dwell on that. You have to move forwards to try and ensure that you're in the best state that you can be to fight any chronic disease that comes your way. Even the flu, even the annual flu that people get, you just have to have your body in a position that it doesn't phase you and you can move on and get through.
Yeah. Yeah. Brilliant. I love it. So let's talk to wrap it up, just your insights as a coach then, bringing in, that's why I love the work that you do. When we have a history, we have a journey, we bring all that into, to the work that we do as a coach. Somebody sitting in front of you, wanting to, staring down the barrel of this, what is some advice and some of your biggest tips that you would give someone who, is thinking about taking that first step?
I think the thinking to take the first step is amazing, because some people don't get to that thinking point. Some people don't have that realization that they want to make a change. But I also think the journey is such a beautiful, powerful journey. I guess you have to be ready to be kind to yourself, to allow yourself to not meet your own expectations sometimes and be okay with that. And just keep holding the hand of your coach, making sure you've got support family around you to help you move through to a healthier version of yourself, I guess. Absorb any information that you can. Listen to the many, many wonderful podcasts that are out there currently to fill you with knowledge. Read books, meet with like-minded people, find a little support group in your community or on your net or somewhere that you have a group of people that are like-minded. Maybe start a walking group, try and get a group of people around you that think the same as you, and make your choice from that light bulb moment to be moving forwards and looking after yourself. It's just so important. It's never too late. It's never too late. I think I saw an article the other day of a 73-year-old that had changed her life and was off all her medication within 6 months, and I thought, wow, that's powerful. That we have that choice, Tracy, don't we? And that's, if you're making that choice for yourself, follow through with it. Build up your support and make sure you stick on that pathway, no matter if you feel like you're lefting and righting of the pathway, because you are still on the pathway.
Yeah. That's brilliant. I love it. I love it so much. And it's never too late. Exactly as you say, if we're living, if we're lucky enough to be here, then it is never too late. I remember hearing a story from one of my GP colleagues, who was talking about a man who came to see him and was insulin resistant, and he was 92. And he managed to reverse his insulin resistance at 92. Isn't that incredible?
Yeah. It's incredible that insulin resistance isn't often tested either. Like, you have to ask for that. In Perth, you have to ask to have your fasting insulin level checked. And that's, I feel like, from all that I know, for what I've been through, that's an important marker that needs to be checked.
Yeah. Absolutely. I remember the discussion I had with Dr. Ben Bickman about that last year, and he was basically saying, it is almost criminal now and negligent for doctors not to test for that. And in the US, I think it's harder to get than here. I mean, at least, I know.
I think along with that as well, if you're at the point of making that leap into the new lifestyle, finding, and you're already on medication, there's so many people already on medication, to find a good low carb GP that will help you get off that medication is so vital. So in Perth, we're lucky we have Dr. Sanjeev. He's fantastic.
Yeah, absolutely. And I'm so glad you brought that up, because I think, it's very important. It's definitely what I encourage, my clients to do as well, because they have the knowledge. These doctors have the knowledge about what dietary changes does in the body. And, not every doctor has that. Every
No.
GP has that. And, things might happen, like your cholesterol might go up, or something might change here and something might change there. And you need a doctor that has that really, broad knowledge of all the other factors that we need to consider when it comes to, So, I'm glad you brought that up. And, thankfully, we've got places like the Low Carb Lifestyle Hub, not for GPs, but for all the other health partners. But then, of course, Low Carb Down Under here in Australia have a brilliant list of many doctors and specialists all around Australia who have put their hand up and said, yep, I'm here to support you with your lifestyle changes. And I have the knowledge. So, it's well worth finding a doctor like that can help you.
Yeah. I agree.
Brilliant. Yeah. Brilliant. Oh, well, any final words of wisdom before we wrap it up? It's been so great.
I think my two books that are really two books I found. One was Beating the Food Giant. It's not a scientific book. It's very easy to read.
Never seen that book.
By Paul Stitt. He's a biochemist, and he talks about the American food system, about how cereals are made, why we shouldn't eat them. That was one of my first books I read. And Pottinger's Cats. I don't know if you've heard about Pottinger's Cats. It's Dr. Pottinger is to do with Western A. Price.
Yes.
And he did a study on 3 generations of cats. So he used cats because he could do 3 generations of cats. If you did 3 generations of people, you'd be in trouble.
Yeah.
And he it would take you a long time. He fed one generation, one family of cats, whole raw food, natural cat food, and he fed the other tribe of cats artificial cat food like pet food, biscuits, processed food for cats. And slowly over the generations, the cats that were fed the artificial food or the takeaway food for cats or the industrialized food for cats their jaws became malformed, their pelvises became malformed, so they couldn't birth their children, which we are seeing in our world today. The cesarean rate is so accelerated. And the infertility began to happen in that group of people. So they're all the problems that we see. It's just a highlight that really we need to eat normal, real food that you find in its natural state. That's as easy as it is. Such a good book.
Yeah. Oh, that's brilliant. I'm going to check them out. I've not heard of either of those. But just on the cats, I remember in a past life I did a bit of acting, and I know. About 15 years ago, I was in a course with a vet. So, he was wanting to do, change careers and do different things. And back then, I remember because I had no idea about low carb at the time. But she was talking about the incidence and the huge issue of diabetes, type 2 diabetes in cats, in pets in particular.
Wow, yes. My friend has a dog with type 2 diabetes, yes.
And that was way back then. And, it's, I think, one of the things I like to say and get people to think about is the fact that the further away you eat, any species, every species has an optimal diet or, appropriate diet. And the further away you go from that, the bigger your risk of getting lifestyle chronic conditions. And, there's so much out there. I mean, Prof. Noakes talks about that, in a lot of his lectures, that you just got to look at animals and what's happened to them when they've been taken away
from their natural environment.
Yeah, and the cats. Look at that. So, real food as much as possible. And,
I love Dr. Bickman. I listen to everything.
Me too.
Yeah, I love him. It's
just I can't get enough of him. I share all this stuff all the time, and he's such a lovely man, as well as obviously incredibly intelligent and smart, and what he's doing for the planet is just amazing.
It's amazing. He is. He's a good guy. He's a good guy, that one.
We'll give him We will. We like him. All right, lovely lady. Well, it was such a pleasure to chat with you, and I have no doubt this conversation is going to spark, people to, if they're not quite there, then it's time.
It's time.
It's time. Yeah.
It's time.
Brilliant. Thanks so much, Lynda.
Thank you. Thanks for having me, Tracy. Bye-bye.